Hi, my name is Annalua, Shahanna, and Bendijo, and I will be reporting to you the part two of my Capstone project, which is recognizing nursing shortages to increase nurse retention. Registered nurses play a vital role in the delivery of healthcare services to individual, family, and community. They serve as advocates to patients in health promotion, health education, rehabilitation, care and support, and collaboration with other healthcare team members in the family. Therefore, it is important that the health workforce must be of sufficient capacity to meet the population health needs. One of Canada's largest healthcare challenges is the insufficient supply of nurses, which can negatively impact patient care and safety, according to Rosenberg. Unsafe nurse-to-patient ratio is related to the prevalence of adverse patient outcomes and increased patient mortality, while for nurses it causes burnout, stress, workplace violence, job dissatisfaction, and the intent to leave the position or the profession. Recognizing the impacts of nursing shortage is vital, as this will help us address the current situation and prevent recurrence or at least lessen its effect in the future by formulating plans and solutions. Retaining experienced staff nurses is a critical intervention to nurse shortages. It can be done by providing healthy and safe working environment with adequate staffing. The first step toward improving nurse attention is to take an initial assessment of nurses' viewpoint on turnover, job satisfaction, and intent to stay, which can be done by conducting interviews, meetings, questionnaires, and can be done by on quarterly basis. After gathering the necessary data, nurse leaders must create a work plan on intervention that can be applied according to the identified problem. Interventions are mostly focused on three factors, which includes autonomy, recognition, and communication. In autonomy, it allows nurses to have more control over their work, promote shared governance and involvement in decision making, therefore increasing job retention. Recognition will make the staff feel valued and appreciated, thus increasing retention. Recognition can be done monthly by creating Employee of the Month award or giving off monthly incentives. Improving communication by showing support to staff nurses by encouraging them to express their views and listening to them carefully will also improve nurse retention. To implement this change, Gene Watson's theory on human caring can be used by creating nurturing environment for nurses, utilizing transformational style of leadership wherein you encourage motivation and positive development that can foster ethical work environment. A study conducted by Solomon et al. In 2020 suggests that transformational leadership is linked to reduced nurse turnover. Autonomy, recognition, and communication were the three strategies to promote nurse retention in healthcare organization. Utilization of these strategies will result in increased job satisfaction, increase intent to stay, and decreased turnover rates. These strategies yield positive impact to the staff, patients, and the family. For the staff nurses, they can enjoy life and work balance due to appropriate scheduling. In a patient safety perspective, nurses' constant and adequate presence in bedside promotes timely coordination and communication of the patient's condition to the healthcare team and the family. For leaders and nurse managers, utilizing and formulating different strategies will further enhance their leadership skills to manage a situation. A barrier that can greatly affect nurse attention is nurse burnout. Nurse burnout is characterized by exhaustion, which is linked to increase in the nurse's intention to leave the job. Aging population, aging workforce, violence in the healthcare settings, and the dynamic changes in healthcare, such as the existence of new diseases, possess a threat that negatively affects nurse retention rates. It is therefore important to ensure sustainability of the strategies to achieve the expected outcomes. To facilitate sustainability in job satisfaction, reduce turnover, and the intent to stay, leaders should develop strategies such as providing a healthy working environment, adequate staffing, and professional development support to the nurses. The government also plays an important function to ensure availability of resources by providing financial assistance and leadership personnel that will support attention to nurses. Nursing as an evolving profession requires nurses to undergo continuous learning opportunities in the form of training, certification program, and community participation to enhance their capacities in nursing practice, thus contributing to their retention and job satisfaction.